segmental muscle rehabilitation. Not to be confused with the long flexors or the deep flexor stabilization, which is more of a global approach. So this is, if I have a patient who comes in, they've got a 5-year history of a motor vehicle accident. I find C23 is not moving. I manipulate it. And I keep her in that manipulated position for about a minute. And then I've got to start working on the muscles. And my first target are the muscles that will draw it into that quadrant, because if that joint has been protected, they haven't worked in that quadrant for years. So clearly they're the first ones that need attention. So what I'm going to do is I place my, if this is C23, I'm going to place my index finger over her C3 facet. And my thumb is going to target the transverse process to produce a sal glide of C2. So I'm blocking C3 here and producing the U-joint sal with my thumb. So it's a C3, it's a C2. Everybody get that picture? Then I'm going to simply say, okay, don't let me lift your head up. Relax, and I gradually take her in towards the end of the barrier. Hold, relax. With craniovertebral locking, obviously, hold if I can. Relax. Hold, relax. So using isometric only, I've got right to the barrier now of that quadrant movement. So now I'm going to bring her back to neutral and say, don't let your head drop. Now follow my hand, I'm going to guide you, but let it slowly come down. Good. Hold. Now I'm going to try and lift you back to neutral, and I want you to resist me. So what I'm doing now is the agonist and antagonist, isometric and eccentric. So I'm training the muscles that go into that, and I'm also retraining the muscles that protect it going into that. So hold, good, let it come back slowly. Hold, let it drop slowly. So I'll work on those two modes first. Isometric, eccentric, and then eventually concentric. Okay, I'm going to do the movement for you. So we'll start with lifting your head back to neutral and relax, let it come down, lift again. So now we're bringing in concentric. So now it's like, hold it there, now let it come back. Follow my hand, let it come back slowly, hold, and now lift it back to neutral. So now I'm doing isometric, eccentric, concentric, one after the other. And I can do the same now with the agonists. Okay, don't let me lift. Let it come up slowly, hold, and now push down against my little finger. Relax, hold, let it come up slowly, hold, and come back down. So both agonist and antagonist, in and out of the quadrant. And with my finger and thumb over the correct parts of the segment, that's how I'm stimulating both U-joint and Z-joint muscle control. So, because I've done it for so long, of course, it makes it look easy. It can get quite confusing when you think, which muscles am I doing? Where's the head supposed to be? If you want to, you can then progress not beyond neutral. So in the end, you can be taking them into the full quadrant and then into the opposite quadrant, going through a diagonal action. And the big question there is, how long have you got? How much can they afford? Because neuromuscular reeducation is not fast. It's not like a manipulation. And more often than not, when they come back and you say, show me your exercises, they get it completely wrong. Moving in the wrong direction. So any questions for that? The key is to offset the Z joint on C3, U joint on C2. Okay, let's practice that, and then we'll have a look at re-educating into a flexion quadrant.
Visit us at ASPIREOMT.com.